If someone who's on video can give me a thumbs up that you can hear me, I'll get rolling. Excellent. So thank you to the 74 people, I guess, who are online at the moment, joining us this morning for this webinar. The goal this morning is to provide an update of what's been happening at the federal and provincial government as we navigate through the initial stages of the response to the COVID-19 pandemic. We are quite short on time today, so by necessity, we're going to prioritize breadth over depth in the presentation, but our goal is to have at least 15 minutes at the end that we can address questions that might go more into depth in some of the issues. So to ask a question at any point that we'll address at the end, you can see a little chat function at the bottom of your screen. Just type the question in there and we'll try and address it at the end of the presentation. There's also one kind of housekeeping matter I'll address at the top. We've included a link to a quick 30-second survey. If you could spare the time towards the end of the webinar to complete this really quick survey, we'd appreciate it. It helps us get better at doing these things. We, like all of you, are navigating the world of trying to do things remotely and via webinar instead of in person more and more. So that would be very, very useful. And with that, I'll get things rolling. My name is, sorry, I'm just trying to figure out how to advance the slides here. My name is Dan Carbon. I'm a principal at Santis Health, and I'm pleased to be joined by my colleague Peter Cleary, also a principal, who is our Ottawa practice lead. Santis Health, as most of you know, is a healthcare-focused consultancy with offices in Toronto and Ottawa. We work for organizations across the public healthcare system, the private sector, and the charitable sector to provide advice on healthcare system strategy, policy, and regulatory affairs. The agenda for today, we're going to spend just a small amount of time on the context and really an update on where things stand in Canada and how the public's responding to it. We're going to talk about the federal and provincial roles in a pandemic, kind of who does what, and then what we're referring to as the phase one response of the federal and provincial governments. And what we mean by phase one versus phase two here is that as this crisis mounts, as we're dealing with a high degree of uncertainty, we're seeing changes in the policy direction of the provincial and federal governments virtually every day, and new announcements every day. We're going to talk about what's happened to date, and then as we, emerge in the next couple of weeks, we would all hope from the very peak of this crisis. What are the next steps that the provincial and federal governments are going to have to do to stabilize the healthcare system and to kind of jumpstart our recovery process? And that's what we're referring to as the phase two. It's not the full recovery from a crisis, but the next stage of the acute response to the crisis that we find ourselves in. And next slide. So this is not new to people. It's as of yesterday, there are almost 10,000 cases in Canada. Cases continue to kind of peak across the country, with Quebec by far the worst hit province at the moment. Next slide. Despite the mounting, what we see is the crisis in Canada and are inundated with our news, we're actually faring at this point relatively well in terms of overall caseload compared to most of our OECD peers, especially compared to our neighbor, which has twice as many per capita cases and far more deaths at this point. Next slide. Everyone's seen this chart, and I'm not going to explain it to people, but the thing that's important from a Canadian healthcare perspective is that this dotted line, the healthcare system capacity, is really important to understand where that line is based on the jurisdiction. And other jurisdictions where the health system capacity is much higher have different policy tools to respond to this crisis. The challenge in Canada, and this is a horrifying chart for policymakers in Canada, is that the acute care beds per capita are the second lowest in the OECD, behind only Mexico, and our ICU capacity is, although slightly better than this, is also very, very low compared to a number of comparator jurisdictions. Hospitals in Canada, in places like Brampton, have been operating at over 100% capacity in any case pre-COVID-19, and we're warning that even a normal flu season could have really tipped them over and created massive capacity challenges. So this is why we're seeing such a focused and kind of harried response, in particular from our acute care system, building new capacity, shipping people out to hotels as much as possible, canceling elective procedures, because they're really dealing with this capacity crunch where Canada's ceiling of health system capacity is lower than other jurisdictions, which is why we're so fortunate that, relatively speaking, we've done well on the public health surveillance and prevention of COVID-19 to date. Next slide. Again, this is not surprising. What you see in gray is people identifying COVID-19 as their #1 issue. Red is healthcare. So combined, you've got almost 45% as of last week reporting that this is essentially their #1 issue, #1 area of concern. Next slide. 70 across Canada, around 70% of the population and climbing, saying they're extremely or somewhat concerned about COVID-19, something that varies a little bit across province, varies a little by male to female, by income level, but is generally consistent in the way the trends are moving. One thing that I find interesting, given the mortality and impact of COVID-19, is that generally the younger you are as an adult, the more concerned you are about COVID-19, with the least concern amongst the 60 and over population, which is very surprising because it's almost the inverse of the mortality rate of the disease. Next slide. There's some differentiation with Conservatives and Greens being a little less concerned about COVID-19 versus Liberals and New Democrats, but again, consistently mounting day by day. One thing to note from the polling is also suggesting is huge support for government at the provincial level, at the federal level, even in the United States. The Trump administration, despite what many would consider a somewhat ham-fisted early response to COVID-19, has seen its approval rating skyrocket. And I think this can be understood from the understanding how societies operate in times of crisis. In any case, we're in a phase of this crisis, of mounting crisis, where studies of previous crises suggest that there is high levels of social solidarity and rallying around government leadership at this kind of time in a crisis. Weeks from now, that kind of social solidarity will tend to weaken. Supports for governments will diverge depending on how effectively they've dealt with the crisis, and you'll start to see more recriminations about government behavior coming from the public. But at this point, there's relatively high level of social solidarity and support for government response at the federal, provincial level and in other international jurisdictions. Next slide. So with that, I'm going to hand over to my colleague, Peter, who's going to talk about the federal roles and responsibility and the response to date.
Thanks, Dan. This slide that I wanted to start with is you could design this in a number of different ways. And I think what we're trying to give you a perspective of is the whole of government approach that is being taken to respond to this crisis. The heightened role of the Deputy Prime Minister, especially with the Prime Minister in self-isolation for a long period of time. And we could probably do a presentation in of itself on what every single one of these departments is doing. But from a high level, you have the COVID Cabinet Committee, and each one of these departments is playing a specific role in the response to the crisis, whether it be on the right end, Finance and Treasury Board, enabling the flow of funds, employment and workforce development, mobilizing funds to Canadians unlike ever before. Economic development, I actually think, will play a role in the longer term, in this crisis, especially as they start having to flow funding on the ground to companies and industries. Whether it be Bill Blair and everything that that department has from an emergency preparedness response, or Navdeep Bains putting funding on the table for Canadian manufacturers to retool. And then, of course, the central role of Health Canada, and in particular, the Public Health Agency of Canada, being the face of the evidence and guiding the rest of government in terms of where COVID is going and what type of supports would be needed. I put PSPC off in the corner there. I think it's just important to note that even though they're not necessarily a central cabinet committee member, everything that the government purchases is being funneled and has always been funneled through PSPC. And they will be a very active role in making sure that, say when the government puts up $2 billion for PPE, actually acquiring, purchasing, and getting it to Canada, that's largely on the shoulders of PSPC. So focus on FAC, nonpartisan arm of government, providing evidence. Dr. Tam has turned into a very trusted face of the government in providing a measured response to Canadians. They play a central coordination role, and keep in mind that FAC came out of what happened in the 2000s with SARS, and I think you'll probably see a reflection taking place once we're through this pandemic in terms of what did FAC do well and what could they do better. But right now they're focused on identifying a need in provinces, identifying that need to the rest of government so they can go out and procure what they need, distributing stockpiles to the rest of the country. And I think one of the big challenges here is that the stockpiles were not as big as what this pandemic requires. And frankly, giving the advice to the rest of government in terms of how they should scope and focus their efforts, learning lessons from South Korea early to prioritize testing and giving recommendations on restricting movements. I think the challenge that FAC and provincial governments have had is that even though they knew the strategy that they had to take, there just frankly wasn't enough supplies and materials to enable that strategy. Getting testing kits to the right places in Canada in the quantities that they needed has been a challenge, and that is why we are in the position that we are today. So how has the federal government responded so far? You can bucket into support for Canadians, support for communities, support for businesses. You have all seen this in some measure or another in the past 2 weeks, whether it's rolling EI out to millions of Canadians probably by the end of the day, coupled with the emergency support benefit that is accessible to pretty much anybody that has been impacted by COVID. There's a bit of a caveat here because I think there will be some issues emerging in terms of how these two programs support healthcare workers in particular that are impacted by COVID. That's something that I don't think government is where they need to be on yet. Deferring student loans, deferring when people need to file their taxes, as well as giving more tax credits and cash to low and middle income families, supports for Indigenous communities, homeless shelters, as well as vulnerable Canadians. With the caveat here, again, the government has said that they will make more funding available to vulnerable communities as that need is identified. And I'll try and be brief, but the big news obviously out of yesterday was what is the conditions for the now 75% wage subsidy to employers? There's no cap on the number of employees that you can access. There's no cap on the number of employees that you have in determining whether or not you can access this. What matters is if you've had a 30% drop in revenue from this period of time compared to the same period 1 year ago. It's about a maximum benefit of $850 per employee. It's only on the first 50-odd thousand of income. And there's a little bit more work that needs to be done here. And I think that was noted in the backgrounder from finance yesterday around some hard hit sectors, including charities in particular that predominantly rely on donations, while at the same time are seeing a increase in the amount of services that they have to require. So the government still has more work that they need to do on that front. And interestingly, on what they've done specifically for health, this feels like an eternity ago when they announced their initial $1 billion, and there was actually a little bit of funding through CIHR that preceded March 27th. But this $1 billion is largely transfers to provinces as well as R&D. And to think about that 1 billion was tripled on a couple days ago only to procure personal protection equipment for healthcare workers. I'm actually at this point, the government had to put a strong focus on supports for Canadians' EI and businesses. But in the grand scheme of things, there's a lot more need in the healthcare sector that is going to be more and more acute the longer this goes on. And Dan will kind of hit on some of the needs of the provinces that will be emerging. But right now, this is phase one. And it's likely and isn't enough for the healthcare sector in terms of what we need today and in the next couple of weeks. So what are the takeaways? I'm sure everybody saw legislation that was passed. It includes some fairly robust measures to give the health minister some authorities that are quite unique in an emergency situation. You're seeing governments talk about how not only has government not been mobilized in this manner since World War II, the Prime Minister is starting to use language, wartime language to Canadians, that the sacrifice they must make in order to defeat this virus is going to be significant and needs to be significant. Money, even though the Prime Minister and the Finance Minister says that we have strong balance sheets to respond to a situation like this, we're going to be in the trillion dollars, and I think we already are when you think about how much liquidity funds they're making available to companies if they need to. The amount of money we're putting in to this crisis is significant, and this is only phase one. And this is coupled with an economic downturn, a lot of industries just grinding to a halt, and at a time when the healthcare system has a greater demand than it ever has been. I would probably argue that the healthcare system, it's almost like a brush fire waiting to happen. The healthcare system was dry grass, and it just needed a spark, and this pandemic is the spark that is showing the weakness in a lot of areas and aspects of our healthcare system. And the fact that we are seeing high demand and have seen high demand, and our ability to, as Dan pointed out already, manage this pandemic is all the more challenging. So the three principles that the government is applying to rolling out funding: accessibility, speed of implementation, having safeguards and criteria in place so that they can show that there's some level of rigor for that money going out, despite the fact that they're focused on speed. But the two reflections I would say is one, those conditions and criteria are slowing them down a little bit. We saw on that 75% wage gap that it was delayed, wage subsidy, I should say, it was delayed by a couple of days as they're figuring out those conditions. I think they're challenging themselves on the number of conditions they're putting in place. And I think they're challenged in terms of the need for more focused health investment that has yet to be rolled out. So I'll flip it over to Dan, who can talk about Ontario. And Dan, if you have control of the screen, feel free to take over.
Sure. Thanks a lot for that, Peter. So I'm going to talk about the provincial level response, talking really about Ontario, but a lot of the things that Ontario is doing are consistent across provinces, and I'll try and point out where there's some deviation. So I actually can't control your screen, Pete, so if you can flip to the next one. Okay, one of the confusing things for the public during this crisis, and a lot of the media commentators have remarked on this, is that the public hasn't necessarily been following the advice of the chief medical officers of health. And there's a tremendous amount of confusion, I think, amongst the lay public and even many in the health system as to what the role of the chief medical officer of health is. And the reality that's being clarified by the COVID-19 crisis is that the chief medical officer of health at the provincial level in Ontario, for example, can provide recommendations and advice to both the government on how to respond to public health crises and to the public. Somewhat confusingly, the chief medical officer of health communications to the public are issued in the form of public health directives, but these public health directives are non-binding. They do not carry the force of law and can't be enforced by by provincial authorities unless they are backed up by provincial legislation or advice. So when the province moved earlier this month with a closure regulation and under the Ontario Emergency Management Civil Protection Act, that was following the advice of the Chief Medical Officer of Health and intended to give some legal teeth, if you will, to the directives that the Chief Medical Officer of Health has been giving. The mandated closures associated with that March 17th regulation that we understand is going to get, Premier Ford said yesterday, significantly tighter in coming weeks, are going to have far-ranging consequences, not just to people's social activity, their sanity levels, the level of economic activity, but also to the healthcare system itself, in that all services that are considered non-essential have either shut down or are under significant pressure to shut down. Next slide. One of the interesting things at the provincial level in Ontario is the kind of emergence of Ontario Health over the last few days as a key player in the provincial response to COVID-19. When the super agency, as it was called at first, was first set up, the question was, well, what is it actually going to do? There was a lot of talk about that it didn't have a role in home care, that it didn't have much of a role on Ontario health teams, one of the kind of government's areas of priorities. But while the Ministry of Health has an emergency operations center centrally that serves as almost the command central for the response, Ontario Health has very quickly become the key linkage point to the health system in tapping into all of the expertise of the system. I think it's fair to say mostly the acute care system, in how to coordinate system level response to the crisis. Just yesterday evening, Matt Anderson, the CEO of Ontario Health, released this chart, which is the oversight table for the system that pulls in system leaders like Michelle DeManuel from Trillium, Kevin Smith from UHN, Howard Ovens from Sinai, and others, each with a kind of working group and core area of responsibility in big hairy areas like bioethics, who gets the ventilators if we run out of capacity. So that the hope is that we're dealing with some of these issues in advance and tapping into the best system expertise possible. Those folks are supported at the regional level by the 5 regional heads of Ontario Health, who are paired with a leader from the acute system in their community. You will notice that there's very little input here from folks outside the hospital sector. It's a combination of senior bureaucrats and acute system leaders, but that's who they're relying on at the moment. Next slide. So last week, the government tabled what they called a fiscal update. Instead of putting forward a full budget, just because of the huge uncertainty at the moment, they tabled an update and a commitment that a full multi-year budget will be released on November 15th. Most germane for this conversation is that the government significantly increased health spending, allocating $3.3 billion additional for health, with $2.1 billion directly targeted to COVID-19. About $1 billion of that is going to hospitals. There's also $1 billion creation of a contingency fund. There's some funding for public health. There's some funding for long-term care. There's funding for 90 transitional programs. I think the major thing to note here is that $3.3 billion is only a 5% increase in provincial health spending. And this is around what the system was calling for before COVID-19. The hospitals were calling for $1 billion in additional funding just to meet capacity pressures previous to this. If you look at the aftermath of SARS, health spending was growing by 7 or 8 or 9% in those years in a recognition of the capacity crunch in the early 2000s. So the expectation is that this is just the initial response of the province in meeting health system demand, and that you could expect that health system spending is going to go up significantly beyond this $3.3 billion injection of funds. Next slide. There was also funding as kind of mirroring the federal response to directly support families in the job market. In Ontario, they're choosing to give a $200 direct payment to all parents with children under 12. Details to follow. Student loan payments are on pause. And there's a whole host of measures for businesses, including tax deferrals and interest relief, that are supposed to free up about $10 billion in cash flow. They've deferred a reassessment of property taxes, and there are a whole host of other changes. Next slide. Unlike in some other provinces, particularly Quebec and BC, the Ontario government has not yet introduced a program for direct cash payments to those who have been forced to self-isolate or have otherwise suffered employment loss. Next slide. There's also been a huge focus, and Pete referenced PPEs, but on supply management overall. And this is an area where Premier Doug Ford has taken a personal role in chairing many of the government meetings, kind of tapping into his private sector background, often in tables with a number of senior level bureaucrats who arguably don't know as well how the private sector supply chains function. So he's been front and center on this, both internally within government and then publicly chastising price gouging and talking about the calls he's making to suppliers to secure PPEs for the front lines in the healthcare system. Just yesterday, there was an announcement. Also, the Tomorrow Fund, that $50 million will be set aside for Ontario-based businesses who can retool to supply PPEs and other necessary supplies during this crisis. Next slide. So some of the key takeaways from the provincial level response, that there's been to give all governments credit, there's been very, very quick and escalating response by the provincial governments in a whole host of areas. The question is it enough? And the expectation is that this is just a phase one, what we call a phase one response, despite the magnitude of it, that will be much, much more needed. Another kind of key area of focus is that, and you've seen it with that command table, there's been a massive focus because of the shortage of acute care beds in Canada on building out acute care capacity and preparing for this surge in ICU demand, which is 100% necessary and required. But what we're also seeing now is outbreaks in the long-term care sector, outbreaks in retirement homes, home care staff that are either not showing up for work or having clients cancel on them, and frail clients in the community really struggling to access care. There's a huge question about PPE supply and protocols, with many frontline providers in the system getting conflicting advice that, frankly, what we're hearing from the front lines, they don't trust, being told to go into homes without face masks and things like that. So this is an evolving area of real need for clarification from the provincial government. The other big thing, and Pete referenced this, is that unlike the federal government, which can literally print money through monetization of debt, we've already seen the Bank of Canada purchasing government debt in recent days. The federal government has arguably unlimited financial headroom. It will lead to issues down the line potentially with inflation, but they can address the short-term financial needs of the response. The provinces don't have that. They don't have unlimited borrowing capacity. So to meet the financial or fiscal needs of the response, they're going to need to lean on the federal government much, much more in order to get the financial headroom they need to do more in terms of health system investment. The final thing that's not on there is that all other priorities in the health system are essentially on hold. So this is, if you're trying to work on an Ontario health team or something like that, good luck. Those initiatives are really on the back burner until we get through this acute phase of response to COVID-19. Next slide. So as we move out of this acute stage, the question is, well, what will the next stage look like? And the major question, as Peter referred to earlier, is how during this kind of crisis that could take many, many months to resolve, do we ensure that all patients, and not just those with COVID-19, are getting access to the services they need? And this comment is not to downplay the significance or seriousness of COVID-19, but during the peak of the crisis in China, COVID-19 related deaths were the 49th leading cause of death in China. People were still dying of heart disease. People were dying of cancer. People were dying of lung illness. People were dying of all kinds of other chronic diseases and complications. And the challenge in a system where we've essentially redeployed so many assets of the system to deal with the acute issues related to COVID-19 are, how do we ensure that people who otherwise need care are going to be able to get that care? And that's going to require, looking at PPEs and the broader supply chain to ensure that's intact, dealing at some point with what will be a massive backlog in elective procedures, the fact that most people can't get access to many community-based services, the fact that we're trying to push people into virtual care models, but we still don't really have adequate funding and support for those virtual and digital care platforms and funding for the providers who deliver despite changes in the past couple of weeks, the fact that we still don't have really enough automated self-direct care tools for people suffering from chronic disease management, and what I spoke to earlier, that funding levels are still a bit depressed beyond what we would expect them to be in this time of crisis. A major funding for the public system overall that a number of you are probably struggling with is that with the economy cratering, there is already a collapsing private fundraising. Many hospitals, many community support agencies, many health charities are dependent on those donations for a significant component of their operations, and that's going to leave a hole in the overall health system if it's not addressed. I'm going to pass back to Peter for the federal
Yeah, I'll just wrap up with a couple thoughts on where the feds need to go. And phase one for the federal government has been rolling out money to Canadians, and phase two needs to be rolling out money to provinces. The role of the federal government as we get through the pandemic stage will start to subside a little bit, and the role of the provincial governments and the need for them to be able to address their healthcare systems will increase significantly. And unless the federal government starts enacting some legislative powers that gives them authority in areas that are otherwise authorities of the provinces, the federal government's role really does turn into how are we going to enable provinces to be able to invest where they need to invest so that they can keep their populations healthy, get their economies running again. I think there's some provinces that have already. I think Newfoundland yesterday sent a note that basically said, we've had to deal with a emergency over the winter with snow, and now this coupled with our economy collapsing, we cannot afford COVID. Our debt to GDP is out of control, and I think that they're one of a number of provinces that they'll start hearing from the federal government on that. And the next comment about the feds operating the bubble, I don't mean that in a negative sense. I more mean it that governments are operating almost with one hand tied behind their back because they cannot respond to this crisis in a traditional manner. Because this is a pandemic, you have a prime minister at home and you have governments that have to operate from home. All your bureaucrats and civil service agencies are at home. And you cannot travel to the front lines like you otherwise would in any other crisis to get a real understanding of what's going on the ground. Governments relying on organizations like yourselves who have a tangible understanding of what's happening to tell them what's going on. And I think the provinces will need to be more and more honest publicly about their shortfalls, which is a risk because they don't want to go out there and say something like, we don't have enough PPE, and we've seen that evolve over the last couple of weeks. But that honesty is actually required right now so that the federal government is enabled to put the money where they need to in order to support the population as a whole. So it's a challenging environment because of the fact that we're dealing with this as a pandemic, unlike any other crisis we would have had to deal with before. And it requires a little bit more honesty and probably public honesty. And I think there's some very effective chief medical officers who have been honest to the public. And I'm not saying that provinces haven't been, but I think there needs to be more specificity in terms of what the challenges are on the ground being delivered to government in Ottawa and being delivered to Canadians as well too. And that will evolve. What does this mean for you? I'll try and frame this in a fairly direct manner. I think Dan and I have tried to hit on the fact that government's all COVID all the time. A lot of health items federally that you would have otherwise expected to be, consulting on right now are not obviously being consulted on because it's all hands on deck to support COVID. If you do need to reach out to government, I think it really needs to be tangibly related to COVID. If it's not, I think you risk your own reputation or drawing resources away to something that is not necessarily priority to government at this time. And to put a finer point on it, people should temper the temper the belief that you can turn something into a COVID issue to get the attention that you would like. I think right now it's really important to engage government if you have to, and if you don't, almost step aside so that they can do what they need to do. Because if this goes well and we start defeating this, you're talking about a number of weeks to a short number of months before government can start putting capacity into other areas. And you should be thinking about what has changed because of COVID. What has changed, do you believe has changed in government because of how we fight this pandemic? How will that influence how you engage government in the medium term? And how is that influencing what your priorities were, what your priorities are now, and what your approach is now? These are things that you should be doing now, because I think when governments are able to put capacity back to the traditional policy areas that they would like to eventually get back to, things are going to move fast, because you have a number of governments who are staring down an election, and they will have to balance this pandemic with commitments that they have made to the public. So with that, I think we'll open it up for questions. I'm not going to unmute everybody, because I think it would probably get a little bit unruly. If you want to go to the chat function and just type in your questions, or even just note if you want me to unmute you so you can verbally ask your question, please do. But Dan and I are on, but we actually have a number of our other colleagues on the line as well too. So if there's a question we don't know, we'll try and get one of our colleagues to answer it. But that's where I would like to leave. Dan, is there anything you want to say before we switch to questions?
No, that's great. There's one question actually already on the board, Pete, that is probably directed to you, which is, to the best of your knowledge, do you think major federal health reforms such as national pharmacare and PMPRB changes will be postponed?
So I think that's a question. There's I believe there's a number of pharma companies on the line right now who are intrinsically interested as to whether or not that would take place. So one, there are a number of things that are not set in stone that the government has liberty to take their time and change tact on. Pharmacare could be one of those. I think there will be a fiscal challenge that the government will have to face if they want to move forward with something like pharmacare on one side of the coin. But on the other side of the coin, you could probably argue that the need for a pharmacare program is probably even greater right now, with a number of Canadians who are no longer employed and covered by private sector, by private insurance. So pharmacare will be very interesting to see how it proceeds. I don't have a crystal ball, but I think that the debate is not over on that, and how this government has approached issues that are, and policies that are important to them. You see them doubling down on something. So, carbon pricing being one of those that kicked in again on April 1st. They didn't shy away from it. PMPRB is a different one that is in regulation to be implemented by July 1st. I think the PMPRB themselves are challenged on how to consult on this in this environment. They would have done a number of consultation sessions. They would have done a number of consultation sessions on the guidelines. I think there's a process argument to be made here that there needs to be some sort of amendment to the process, given the fact that people are at home people are working from home, not at the office, and there haven't been the consultations they otherwise would have expected. I'm not sure what tools the government has to delay a regulation. That's a little bit more of a complex question when it's already set in stone. And I think this government would probably argue that this is one of their core beliefs, that it should move forward. And if they want to show that they're spending money on all these other things, that they need to save money where they can. So I think there are arguments that will be a challenge to make if you do not support PMPRB, and if you do, you probably don't have to do anything at all.
So Pete, let me push you on that, or clarify a little bit. So what you're saying on PMPRB is that regulation is set to come into force in July, and there are no clear signs at the moment
Correct.
that the government is backing away from that. On
Correct.
pharmacare, it's unclear what the implications will be, but the expectation is that given this government's background, that in say 3 to 6 months, this is something that they will turn their attention to and will have to make a decision on how they proceed.
Yeah, I think you nailed it.
Is that fair?
I think you nailed it.
Okay, thanks. That's helpful. Any other questions, folks? Don't be shy.
I should say, I think there was a question at the beginning in terms of sharing the slide deck and recording. We do make a habit of recording and posting this material. So I'm not sure where it goes, but we'll make sure we get it out to people. So if you want to revisit this webinar, there will be the ability to do so.
Yeah, and I'm not sure if we have everyone's information who's signed up. So if anyone would like a copy of the slide deck and recording, please just in the chat box on the side, record your name and information, your email address, and we'll send it on to you directly if we do not already have it on the distribution list. And I guess if there's no other, oh, sorry, here we
go. You should answer this one, Dan. Some excellent person named Jim, who I'm sure is an amazing individual, said, do you anticipate any lingering effects on the current peace, love, and harmony of relations, particularly in Ontario? So why don't you take a stab at that one?
Lingering effects of the peace, love, and harmony? I don't know. It is interesting times, isn't it? That when you have some of the most partisan, traditionally partisan leaders in the country refusing to take any partisan swipes at each other and really rallying behind that kind of Team Canada approach, you would like to think that if it pays dividends for them politically, and you see, governments like the Ford government in Ontario that has really struggled, and the bet before COVID-19. I mean, this is unfortunate in some respects that we're thinking like this or talking like this, but that before COVID-19, the Ford government seemed somewhat dead in the water, and with Ford very personally unpopular. If he shine or continues to shine during this crisis and comes out of that and attributes some of that to his ability to have moved to the center to a more consensual approach of politics and to actually get things done for people in Ontario in partnership with the federal government, who knows? Maybe that becomes a more the style of government, a more traditional style of government in Ontario when he sees the positive benefits in working in that way. But who knows?
We have two more questions that popped in. So Manny asks about if the government is keen on PMPRB, could they force a consultation before July 1st? That's a good question. I was musing about this one yesterday. I would highly suspect that the PMPRB is trying to figure out how they can be undertaking digital consultations. And I would say it's not just PMPRB, all of government's trying to figure out how do they return to some level of business if this environment will continue for the foreseeable future. I have the utmost confidence in our public servants in figuring out new novel ways to do things. But if there's one thing that I could reflect on the federal government, they're really bad at doing things digitally. I mean, we still operate on a very paper-based docket system in the federal government that feels like it's from 60 years ago. So even though, yes, they could, I think there's some work that the federal government needs to do to become more digital, and they're going to be really challenged to figure out how to do that with all the restrictions they have in place on how they share information. They're just not set up to do it, frankly. And then there's another question. Unless Dan, go ahead.
Yeah, there's one more question on drug supply issues, and we'll make this the last question. We're not even going to be able to scratch the surface on this. I think the short answer on this is you're going to see a lot more in drug supply challenges coming in coming weeks. I was on a call yesterday with someone that talked about the supply chain issues in delivery for certain types of medications going to pharmacies, pharmacies having limitations put on some of the supplies. So not just for the anti-malarials that are looking extremely promising as a potential treatment for COVID based on studies that were profiled yesterday in the New York Times. There seems to be some challenges for medications starting to appear more broadly. And I think that's something we'll have to track very, very closely in coming weeks. And I referenced that in my comments as one of the challenges in the supply chain, making sure that's still robust, not just for PPE, but more broadly for the health system. And I think with that, we're going to wrap things up. Thank you all for attending today. As referenced, there was a link to a survey that I think we'll put at the end of this again. If you could take 30 seconds to complete it, we'd really appreciate it. Thank you very much for your time today. And other questions that are sent in, we will try and address in follow-ups. Thank you.